Hey, my name is Michaela, and today I want to talk about shin splints, and in particular, how shin splints is caused by can affect sprinting. In this video, I will be covering what shin splints are, what causes them, how they affect sprinters specifically, and what can be done to prevent and treat them. So what are shin splints? Shin splints are also referred to as medial tibial stress syndrome, or MTSS. They are characterized by tenderness, soreness, aching pain, and swelling along the tibia. They are most common along the posterior tibialis, or the inside of the shin bone, but they also exist along the anterior tibialis, or the outside of the shin bone. Shin splints are most common among runners and dancers, but they also occur in sports which entail a lot of hard impact and jumping, such as volleyball and basketball. So some of the causes of shin splints include repetitive stress on the shin bone and the connective tissues that attach your muscles to the bone, suddenly increasing the intensity or frequency of training, switching from a soft surface like a trail or grass to concrete or a track, flat arches in the feet, which can make the feet roll inward when running. Also, CT scans of the tibias of runners with shin pain have shown pockets of low bone density that appear at the location of pain, which can lead to a slight bending of the bone when it is loaded. In relation to that, bone density scans, like the one shown on the right, can be a reliable way to identify if low bone density is the cause of shin pain or if a stress fracture has occurred in more severe cases than the x-rays on the right. Also, new running or workout shoes, or on the converse, if you wear your shoes too long and they wear out, this can also cause shin pain. So now we're going to talk about how shin splints are specific to sprinters. Although shin splints affect a variety of athletes, there are a number of reasons why they affect sprinters in particular. For example, sprint training entails an excessive amount of repetitive force on hard surfaces in spikes that have very little support, which causes hard force on the shin bone and the tissues which connect the muscles to the bone. Sprinters also run at a slight angle towards the left side of the body regularly because of the curve of the track, which increases the amount of pressure on the outside of the left shin. So shin splints and even stress fractures are even more common on the outside of the left shin in sprinters than they are in distance runners. Sprinters are also forced to maintain dorsiflexion when they run in order to run faster. In other words, their toes are being pulled up by the anterior tibialis. The anterior tibialis absorbs 70% of the sprinter's body weight when he or she is running, which is a lot of pressure for a fairly small bone. Okay, so I have attached a video of a block start from Allison Felix, who is an Olympic and professional sprinter. This video of Allison Felix shows a very good demonstration of a block start. Notice the dorsiflexion of her feet as she comes into contact with the ground and the amount of force that she exerts as she pushes off. You can literally see her lower legs shaking slightly from the impact. Alright, and now we're going to talk about prevention. There are a few things that can be done to help prevent shin splints. For example, analyze your movement using a video to determine if there is something that you can change about the biomechanics of how you run. Avoid overloading your body with too much training. Wear comfortable, supportive shoes with really good arch support and change them before they get too worn out. Also, orthotics are a really good option if you have issues with high arches. Consider cross-training with something like biking or swimming to reduce the amount of stress on your shins. Add a strength regimen into your training to strengthen your calves and shins, and make sure that you put a lot of focus on your strengthening your calves and your ankles too. Avoid running on hard surfaces like concrete or blacktop. Even track sometimes can be a little bit too hard on the shins if you're training extra. Stretching regularly maintains your flexibility, and that will help reduce injury. And make sure that you're getting enough calcium and vitamin D to support the amount of pressure that you're putting on your shins every day, so that you have really good, strong bones and muscles. And finally, we're going to talk about treatment. It can be really frustrating once you start experiencing shin splints, but the best way to recover quickly is to rest. Switch to bike, elliptical, swimming, or anything that reduces the impact on your shins for a short period of time, and it will speed up your recovery time like nothing else. Ice your shins multiple times a day. Consider a cold whirlpool if you have access to one, or massaging your shins and calves with ice. This can be done by freezing a small amount of water in a paper cup, and then once it's frozen, tear off the edges and rub away on your shins where it hurts for 5 to 10 minutes. If you have to continue training, consider taping your shins or purchasing shin compression sleeves like the ones that Allison Felix is wearing in the picture, and that'll help reduce the amount of pain that you have from your shin splints when you're training. And finally, foam rolling is really, really important. Foam rolling on the calves reduces the tight muscles and helps your shins feel better even faster. Alright, that's all I have for you today. Thanks for watching. I hope you learned something and enjoyed my video.